Did you know that in Japan, health insurance is not optional? Whether you just arrived, you're studying, or you're working, you're required by law to be enrolled in a health insurance plan. And if you're not enrolled, you could face huge medical bills and even problems when renewing your visa. In this video, I'll explain everything about Japan's health insurance system for foreigners, what Kokuhō and Shakai Hoken are, which one applies to you, and exactly how to enroll. Let's get started. Japan operates a universal healthcare system. Every person living here, Japanese citizen or foreign resident, is required by law to have health insurance. This system is called Kokumin Keiho, which literally means National Universal Insurance. Here's why it matters for you. Without health insurance, if you visit a doctor or hospital, you pay the full cost 100%. That can be very expensive, especially for treatments, surgeries, or emergencies. But with insurance, you only pay 30% of the medical cost. The insurance covers the remaining 70%. Also important, if you are a foreign resident staying more than 3 months, you are legally required to enroll. Not doing so can affect your visa renewal. Now, there are two main types of health insurance in Japan. Let's look at them one by one. The first type is called Kokuho, or Kokumin Kenko Holkon, in full, which means National Health Insurance. Kokuho is managed by your local city or ward office. It's designed for people who are not covered by their employer's insurance. This includes freelancers and self-employed people, students, part-time workers who don't qualify for company insurance, and people who have recently left a job and haven't found a new one yet. To enroll in Kokuho, you need to visit the National Health Insurance counter at your local city or ward office. You will need to bring your residence card, Zairu card, your passport, and your My Number card if you have one. Very important, you must enroll within 14 days of arriving in Japan, moving into the municipality, or losing your previous insurance, for example, when you leave a company job. If you enroll late, the premiums will be charged retroactively, meaning you have to pay for all the months you should have been enrolled, going back up to 2 years. And during that uninsured period, you would have had to pay 100% of any medical costs. So please don't delay. Enroll as soon as possible. The cost of Kokuho depends on two things: the rules of your city or ward and your previous year's income. Each municipality calculates premiums differently, so I can't give you one exact number. However, as a general guide, the lower your income, the lower your premium. If your income was zero, for example, if you just arrived, you may qualify for a premium reduction. You can check your estimated premium on your city's official website or ask directly at the ward office. One important point: with Kokuhō, you pay the full premium yourself. There is no employer sharing the cost. The second type is Shakai Hoken, often called Kenpo or social insurance, and it is the insurance you get through your employer. If you work full-time at a company or at a company that employs 5 or more people full-time, you will likely be enrolled in Shakai Hoken automatically. The big advantage of Shakai Hoken is this: your employer pays approximately half of your insurance premium, so the cost to you is lower than Kokuho for the same coverage. Shakai Hoken also includes pension insurance, Kosei Nenkin, as a package. You cannot choose one without the other. You qualify for Shakai Hoken if you work at a company that is a mandatory coverage business, which includes all legal corporations and businesses with 5 or more regular employees. Foreign workers are treated exactly the same as Japanese workers for this purpose. Your nationality does not matter. Part-time workers may also qualify in some cases. Since October 2022, part-time workers at larger companies who work at least 20 hours per week and earn a monthly salary of at least 88,000 yen are required to join Shakai Hoken. If you're unsure whether your workplace covers you, ask your HR or accounting department. Your Shakai Hoken premium is calculated based on your standard monthly salary. The health insurance rate for most employees is set by the insurance association they belong to. For employees covered by Kyokai Kenpo, the most common one, the rate varies slightly by prefecture. In Tokyo for fiscal year 2026, it is 9.85% of your standard monthly salary. But here's the key point. You only pay half. Your employer pays the other half. So, for example, if your monthly salary is 300,000 yen, the total insurance premium is about 29,550 yen, and you pay roughly 14,775 yen. Your company pays the same. The premium is deducted automatically from your paycheck, so you don't have to pay it separately. Note: rates change every fiscal year, so please check the latest figures on the Kyokai Kenpo website. Let me now summarize the differences between Kokuho and Shakai Hoken in a simple table. Who is it for? Kokuho: freelancers, students, part-timers without company insurance. Shakai Hoken: full-time employees and qualifying part-timers at covered companies. Who manages it? Kokuho: your city or ward office. Shakai Hoken: your employer and the National Insurance Association. Premium. Kokuho: you pay 100% yourself based on last year's income. Shakai Hoken: you and your employer each pay about 50%. Coverage. Both give you 70% coverage from most medical costs. You pay 30%. How do you enroll? Kokuho: you must go to the ward office yourself. Shakai Hoken: your company handles the enrollment. Bottom line: if your company offers Shakai Hoken, it's almost always financially better than Kokuho, because your employer pays half. If your company does not offer it, Kokuho is your mandatory option. Once you are enrolled, you will receive an insurance card, or in many cases, you can link your insurance to your My Number card. When you visit a doctor or hospital, show your insurance card or My Number card at the reception desk. The hospital will then charge you only 30% of the treatment costs. The insurance covers 70%. If your medical expenses in 1 month are extremely high, there is a system called High Cost Medical Expense Benefit Kogoku Ryōyoi. This sets a monthly cap on how much you pay. If you exceed that cap, you can apply for a refund. For Kokuho, apply at your ward office. For Shakai Hoken, contact your insurance association. Before we wrap up, let me share the most common mistakes foreigners make with health insurance in Japan. Mistake 1: enrolling late. Many people think they can enroll whenever, but late enrollment means retroactive premiums for up to 2 years and no coverage during that time. Mistake 2: forgetting to switch from Kokuho to Shakai Hoken when starting a new job. Once you join a company with Shakai Hoken, you must unenroll from Kokuho at the ward office within 14 days. Mistake 3: forgetting to re-enroll in Kokuho after leaving a job. When you leave a company, your Shakai Hoken ends. You must enroll in Kokuho within 14 days. Mistake 4: not paying premiums. Unpaid Kokuho premiums can affect your visa renewal. Always pay on time. Key points to summarize in Nepali. Japan requires all foreign residents staying 3 months to have health insurance. 2 types: Kokuho National for freelancers, students, part-timers, /Shakai Hoken Social for company employees. With insurance, you pay only 30% of medical bills. Enroll within 14 days. Late enrollment means retroactive premiums. If you work at a company, Shakai Hoken, otherwise Kokuho at City Hall, don't forget to switch when changing jobs. Links and more details are in the description below. I hope this video helped you understand Japan's health insurance system. If you found this useful, please like and subscribe. It really helps the channel grow. If you have any questions, leave them in the comments below and I'll answer them. See you in the next video.